All right, Jesse, can you hear us?
I can.
All righty. It's a good thing.
Do you want to try this?
No, he might not.
Okay, go ahead.
All right. And it's that time, so we will go ahead and call the meeting to order. And I would entertain a motion to approve the open session agenda.
You will make a motion to approve the open session agenda?
So I have a motion from Aaron. Do I have a second?
I'll second it.
All right, and a second. Yes. Since we have Jesse on, Zoom, we will go ahead and do roll call votes this evening if we can. So let's do that. Okay, Nick,
Yep.
Aaron,
Yes.
Chris,
Yeah.
and Jesse?
Yeah.
All right. And then I would also entertain a motion to approve our executive session agenda pursuant to Missouri Sunshine Law 610.021, Sections 1, legal, 3, hiring, firing, and discipline of employees, and 13, individually identifiable personnel information.
Make a motion to approve, going into closed session, 610.021, sections 1, 3, and 13.
All right, so I have that motion from Chris. Do I have a second?
I will second.
And that was from Aaron. All right. And if we could once again just do a roll call vote since we have some on Zoom. Nick,
Yes.
Aaron,
Yes.
Chris,
Yes.
and Jesse?
Yes.
All right. And then if we could also approve the minutes from the October open session.
I move that we approve those minutes.
Motion from Nick,
I'll second it.
second from Chris. Do the roll call vote, please. Nick,
Yes.
Aaron,
Yes.
Chris?
Yeah.
Jesse?
Yes.
All right. I did not receive any public comment forms. Did we have any turned in? All right. Then we will move on. I'm assuming everybody got the departmental reports. Everybody had a chance to look those over. Did you have any questions about any of those reports as you went through those?
I was curious about,
Sure.
not a question per se, but I believe Angela's report about the revenue cycle
Okay,
mentioned twice in there about possible cost savings. One being the lockbox and the second one being, I believe, mail services.
mm-hmm,
I just thought we could discuss how feasible that is,
okay.
if we would need additional staff to bring that in-house, just
Mhm.
what, maybe cost savings or what options were maybe there.
So right now, I've got IT testing, with, the part of Meditech that would actually be doing the setup for those forms to see if it would actually work. And if it does work, then we would be able to, we're gonna test the hospital statements first, because they would be fewer than the clinic statements. And then we would be able to stuff those envelopes using the patient access staff at night, because a lot of times there's not really much going on, so they could stuff those envelopes at night. It also would give us an opportunity to glance at them before they go out, so if we see something that's overtly wrong, we could not send that statement out until we get it corrected, and then we could, print it again if we needed to, so that way it would be accurate and it would go out. Because a lot of times right now, we're seeing some errors, but we don't see them because they already are uploaded and go to mail services, and then we get the phone calls whenever there might be an error. So we would be able to pull it all back in-house without any problems. We would just need to buy envelopes, it's gonna be printed on plain paper, we can, I think we can run them through, Jonathan, he's not, he left. We're gonna be able to run them through on our printers that we have here. We think we can run them through our big machines, so that way we can do a lot at a time. We sometimes get free toner throughout the month, so that would, we wouldn't be out the extra toner for that. So we think we would be able to save quite a bit of money on that process.
And we wouldn't need staff.
And no extra staff.
What about like ETA? You mentioned like your tech's doing it, whatever, but like what could that?
Well,
transition?
my thought would be that we could probably get them stuffed in 2 to 3 days and still hit our target of when we want them to go out in the month. So we would print them, get them all done, and get them stuffed and ready to go out. And so we could either do them in mail them out in increments, or we can mail them out all at the same time.
More meaning like,
Oh.
could that be off the ground year,
Oh.
net 2022, or is that
Oh,
a?
yeah, we're
2023
gonna,
project?
whatever I hear back from Jonathan, hopefully tomorrow or the next day, then we may be able to do it this next month.
I was just looking at the numbers you provided.
Yes.
You're looking 90 grand a year.
Yeah.
So-
So that's good. The
Yes.
lockbox, did you ask about the lockbox?
Yeah, yeah, just
So
what you
that-
mentioned there about maybe the elimination or
Yeah.
doing something different.
That's still, I don't know, do you know specifics on the lockbox? We're kind of waiting whether or not we keep it or.
Right now, I think it's worth it to keep it. Joaquin's looking at more of a feasibility, from a feasibility standpoint, and Angela can speak to it as well, but I think it does a lot of work for us right now. And to cut ties with it right now would kind of cause a little bit of chaos, which is the last thing we need in the building office at this point while we're rebuilding. So in my opinion, I think we should hold on to it for at least a little while longer until we can do a full evaluation of it.
Last I was told was they were going to, because things that go through lockbox have a charge for transaction, but, depending on how we're using it and the monthly fee is how we're using it offsetting what we're paying for that service. So they were gonna do a little more investigation, and plus we don't want to throw any chaos into the business office while we're trying to fix other issues. So then, once they determine the cost versus what it's supplying, am I saying that correct?
Yeah.
The services, then they were gonna get back to us on that.
The way I look
Cause
at
I
it-
asked about that, so.
The way I look at it is just kind of simple math, it's only about $1,500 to $1,600 a month. So, I mean, for a full year, it's.
But
less
that's
than-
not the only cost.
It
that's the
comes out to
mon-
be about that.
Well,
much.
that's the monthly cost is what I was told, plus there's a per transaction. Isn't that correct?
It's very small,
But there's still a cost.
yeah, but the total is about 1,600 a month,
Okay.
with transaction fees.
Oh, that's with the transaction.
Yeah, it's about
Okay.
1,500 for just the month, and then I think 1,600 with transaction fees.
Okay.
So it's
Okay.
pretty small. So less than 20,000 a year, which I mean, you can speak better about this than I can, but to me, I would think you'd probably need another full-time employee to do what that lockbox is doing. I
Well,
could be wrong.
we were actually doing it before we turned it over to the lockbox.
Okay,
So,
so
I
you
mean,
could probably take it back on.
We could take it back in.
Okay.
It's helped us get organized, so we know where everything's at now.
My question is, there were some errors in it that were happening, so that was my concern, with some billing or something, so.
We've had a rough start with them.
Yeah. So
I will say that, I'm not gonna
that,
fib.
that was the thing, that if it was going to be more of a problem, why pay for a product? So, that's my question. So,
From my end, it seems to be performing a lot better. It's
Yes.
bringing in about 4 times as much money as it was. So,
but again, if we're paying that a year, that can be money there still if we can do it now. So
Yeah.
that's what we have to look at.
Yeah.
If we're looking at costs, then we want to look at all those costs. So, that's.
Right now, it's kinda helping us, it's allowing the posting team to go through spreadsheets that AGS left us and get a lot of the follow-up done that we wasn't able to get our hands on. And so it's allowing us that time, so they go out, they get the posting done with Commerce first thing in the morning, and then they start working on the spreadsheets to work on all the follow-up stuff and get out paper claims that we need to get out. So it's allowing us time to do that. I would say if we had to do if we had to pull everything down, plus do the follow-up, we probably would be maxed out a bit. But right now, we're not.
Right, so that's something I think the business office needs to talk about, if it's doing a purpose, we can afford it. So that's something I think that has to be left to the revenue cycle and then talk to us about it once it's,
Yep, absolutely.
once they check all those things.
Yeah.
So. Any other questions? Does that answer your question?
I know Travis brought this up in his email, but it's something stood out to me too, about the people calling in and harassing the building department. It's like, that's something they shouldn't have to put up with.
Well, that's something when you deal with the public. When you deal with the public and you deal with, I think, their money.
Yeah.
I think, we've had such problem with billing. That's been a major issue. And we are trying to correct those issues, but, people get a little testy when we've had billing errors, repeated billing errors. People get a little out of sorts when they're repeated errors. And so I'm not justifying bad behavior. Bad behavior is bad behavior. But I also, it gets, when we do have repeated errors, I think and sometimes they're not explained well, then I think people get they want a reason, why do I keep getting this? Why is this happening? And when it does keep happening, then sometimes they're not always as easy as reasonable.
Yeah,
And
we're fixing, bringing it back in-house, if we bring the statements back in-house, we'll get to look at those before they go
Right.
out. I think those are all the steps that need to be taken.
that's what I was gonna say,
Fixing the problem,
I
so.
think we're trying to fix the issues, and hopefully that will reduce the problem.
That's the only way we can get to be able to see every single thing before it leaves the building. That's the only way to do it.
I agree.
And if we have to hold that one that month, we hold it till we get it fixed.
Yeah. And I think we're trying to do the steps that hopefully will correct
Yeah,
the deluge of some of
yeah.
that. And so.
Cause if we could
hopefully-
eyeball them, we could definitely
Yeah.
tell that, oh, this one's wrong, we're gonna keep this one back,
Yeah.
or whatever, so.
And I think we're trying to do that,
And-
so.
And then you can actually do something to fix it instead of
Right.
depending on
Right.
this company that
That's
does
right,
it wrong and there's nothing you can do about it.
that's right.
So,
Employees just know not to take it personally, they know it's not personal.
and I think if it gets really bad, I think you all can also say, could I have someone else talk to you?
We've done that before,
You just have to,
we've done it before.
and I know it's not pleasant. It isn't pleasant to have to deal with,
Or
and.
sometimes we'll just say, let me check into this, I'll just call you back in a little bit. To
And,
cut 'em
and
off,
sometimes that's
Like,
the best way, say, look, let me check through this account, clearly there's an issue, and let me check it, and give me a number, and I'll call you back. It gives them time to cool down,
Right,
gives you time to check through what the exact
Yeah.
issue is, and
Yeah.
sometimes that's the best way to handle that situation, but, always assure the customer that we are here to help,
Oh,
and
yeah.
they have a
We always
problem,
do.
and, we're gonna fix it.
yeah, we
So-
thank them for calling, whether it's good news
Yeah.
or bad news. We thank them for calling.
And we are taking better steps to correct that
Oh,
problem.
absolutely.
And so, and I think we are taking
Yeah,
those steps.
every
So-
day.
So, anyway, hopefully those kinds of calls will happen less frequently as
We hope so
we correct those errors.
We
So,
hope so too.
alrighty. Other questions in the departmental reports that you saw or things you just wanted to comment on?
A lot of information,
Yes, there was,
Good
there was
reports.
good information. No, it's,
I don't have a ton of these color copies, so I might put one between.
that's fine.
This is how I like to see the finance report. I know it's not an
Mhm.
income statement or, balance or whatever wordage you call it, Brent. I like to see department by department. It does show we were positive for October.
And I think at some point, when we have a better handle on our finances, we will have more official finance
Sure.
reports such as income statements, balance sheets, and that sort of thing. Right now, it's very difficult to, decipher what our general ledger has in it. We just officially closed the books for last fiscal year, so that's
Right.
ending in June. So our data from July, August, September has not been finalized in Meditech in our general ledger right now, so it's kind of hard to have super accurate reports. We think that this is relatively accurate. It gives us
Yeah.
a good idea of what we're looking at.
And I just like to look department to department where we're at and, some of the administrative things that you'll see in October. We had a recruitment fee for physician recruitment, made that go up, legal fees, and then Caravan Health, we had a large bill there that went under administration. Another number that stuck out to me was cardiac rehab. I'm not sure why their numbers dropped so much in October, but we're looking into that. Those are just some questions I had when we looked at this today, but if anyone has specific questions, we can try to get those answered, after you, and you can take that home, look at it, and ask us questions later. And Anna's thing to me says Tammy hasn't done the manuals for October yet, so there's no insurance. Looks like there. So Anna just slid that over, I think, as a guesstimate.
Any questions?
And they're basically just letting the tool do the contractual adjustments. They aren't messing with any of that stuff right now, cause we're just gonna kind of over time see
Mm-hmm.
how that works, so.
Kind of goes in line with that service department, thing we did earlier, that talks about which ones are, you know.
Yeah.
Okay. Any comment from the board? Alright. Wanna go ahead with your report?
Yep. So I've mentioned the recruitment fee. We have a recruiter that's been awesome. He kind of has talked to several family practice doctors, but I nailed down, he's a family practice who's doing OB residents. He'll be done next year. I actually have lunch with him Saturday in Des Moines. His wife is expecting their first child. They wanna live in a rural area. Memphis is between his family and her family, so they're very interested in this location. He's training to do C-sections, so he would do everything. So hopefully that lunch goes well on Saturday, and I need to get with Dr. Davis Humes about all the answers and questions that he might have for me. 340B update, 20 manufacturers online, so that's, all the drug manufacturers we have contracted through 340, those are all name brand drugs. You can kind of see quarterly, I had Anna pull from our third-party administrator what we have brought net into our facility from the 340 program by quarter this year, not fiscal year, just from 2022. So it's kind of, it easily shows that, Stroudwater, they reported we should be around 1.3 million with the 340 program based on our numbers, and if we, starting in September, quarterly, it's gonna show that we'll net about 1.3 million or maybe more with our 340 program. So we've, fixed the holes in the manufacturers online there, and it's going pretty well. Anyone have any questions on that? The care center update, we are looking into a feasibility study I know Travis had some questions on that. We don't have a management agreement with them, obviously, but the feasibility study would show what we could make work with them. It's just kind of still up in the air on where we're going with that. Obviously, we wanna support them in their endeavor to reopen the care center if we can. But again, kinda need to wait on some more information on that before we dive into that sort of thing. They'll have their meeting tomorrow night, so. Do you have anything else in there?
I think I had something in mind for a bit, I can touch on it. Talking with the care center, next steps for them, I said a good place to start would be to look at, having people go out and do the trainer program, which is where you have an RN go out and you have them train at through a certified program so that they can train, what is called a level 1 medication aid, which is your, main, person or staff person in a assisted living facility or residential care facility. And if they really truly are looking at reopening, that would probably be their first step. And I said that we had some nurses here at the hospital that would be willing to help out and do that. Ashley said that she would be one of them, and they said that they would pay for all the fees and all the expenditures that go along with that program, if that's something that the hospital would agree to. And I wanted to propose that to the board if that's something that we can move forward with, sending some of our nurses to do that training. Of course, nurses that want to do that would be willing to do that. So that's what I would propose so that the hospital could, that's one way the hospital could help out the care center. And I think that'd be a great first step towards that next goal. So I guess my proposal to you is, can we move forward with the trainer program with a select few nurses in the hospital?
Do we need to wait for the feasibility study or how is that?
They're gonna need the staff and.
We can, I would like.
I'm not saying we should,
Yeah, I would like to be more prepared, because if they're willing to take on that expense and they're gonna pay for all the program and everything, they just need nurses that are willing to do it. And it's a small part on our end that we can do to help them out and step further. Because that's a process, it's gonna take, from the time we send a nurse to the train the program, that might be months, they might not have an available program for a couple months down the road. So once we send them there, then that takes a little while. It's actually, I think it's a weekend program, so that part doesn't take too long. But then you have to find people from the community that wanna come in and be a level 1 medication aid, which the assisted living facility would need probably at least 6 to run on a full-time basis. So you have to find 6 people from the community that are willing to do that. Then you have to go through and do the training with them. So, I mean, this could be a multi-month process, and it could be a, I guess, bottleneck at some point that I was trying to get ahead of.
Is there any benefits for the nurses that elect to do this? Any perks for them? Or is it just
That's a good question.
kind of
At some,
volunteer
there should be,
done?
at some point.
Like you said, Ashley, but it'd
Yeah.
be hard to get many people on board if it's just.
Yeah, that's true. I think Ashley was willing to do it out of the niceness of herself, because that's the kind of person she is, and she wants to help the community. So I think there should be, that's something I haven't brought up to the nursing level, that they should pay for every person that they train, they should be paid for.
Well, and we have seminar time, we can pay the staff, the time that they spend doing it.
It's just, however it works out, that should be a consideration.
Absolutely.
They're expensive. Would you pay to travel there and do it? I don't see them.
I don't.
You just waiting for a motion?
Do you need a motion?
I don't know.
I think you should have a motion, just so that it's in the minutes.
Yeah.
So, do I have a board member who would like to put that into a motion?
I will, figure out what sound I'll move that we support
And the training
train the trainer program
for the nursing.
proceeding the nursing home.
I have a second. Let's do a roll call vote on that, please. Okay, Nick?
Yep.
Karen? Chris?
Yes.
Jesse?
Yes.
Alright, one comment, the parentheses is positive, I don't know, our system is backwards, so, just FYI, I'm sure you probably caught that, but I was
But I
confused
thought
by
I
that
had to
beginning,
ask,
so
to make sure.
the parentheses is, positive numbers.
A lot of county systems are that way.
Billing revenue update, Angela kind of touched on that, we're catching up. I had 10 days, but it might be different now. I think we're 2 weeks behind in the hospital,
2 weeks behind the hospital, 2 weeks in the clinic.
still better than we were, so
Yeah.
improving.
We're holding steady,
Yep.
Only 2 weeks in the clinic?
2 weeks in the clinic.
Well, it's better than this, 3 weeks.
Yeah, it's-
No, it's a-
Yeah, we're
Technically,
moved
we're
ahead since
13
I,
days, but
yeah, it's moved since I did my report, which is good.
Yeah.
Med Club, we've confirmed with Scotland and Skylar, we have dates for their club meetings, it's going well, we have a date set for AT still, and we'll continue to reach out to the schools to do their Med Club programs as they respond. I did wanna ask for, this would be under like continuing education for me. The National Rural Health Association is doing a CEO certification. Actually, Kevin at Oskaloosa highly recommended the program. And I just took this from their website. I've registered for the webinar to learn about the program, but I think I would need an approval from the board to participate and pay for that program.
9,000 for upfront cost.
Total, yeah. So it just kind of shows you there what their purpose was for creating the rural health, or the rural hospital CEO certification program. And my webinar on that is next Wednesday to learn exactly how that works, so. I don't know any start dates or anything like that yet. So we can touch on that again next week, or next month, if you wanna wait on that, when I have more specifics. But I just wanted to go ahead and let you know that I was interested in that program. Again, we're working on staff incentives to look for grants, identify them, and then come up with ways we can implement grants for the hospital. Still a work in progress, it's just there's a ton coming at us and we don't have the staff to keep, just organizing it is a feat. All the HRSA and USDA grants that are available, we're just working on getting staff involved in that process. Knox County Nursing Home, I met with their administrator. I think we're gonna start currying the labs from the nursing home to here. And I also will address that with Skyler County Nursing Home. It will help both of them to get their lab results faster for the physicians that see those patients. We already curry Clark County Nursing Home labs here, so. And then I just put a thankful note in there just because it's been great having the support of the board and you guys allowing us to address problems and fix them and make this place a better place to work. So I appreciate all of you guys. Any questions for me from that?
Any questions?
We have some good things on social media.
Yeah.
How things are going on.
Trying to put good news out there.
Yeah.
Yeah.
I didn't put it in my report, but you touched on it a little bit in yours. I was just gonna say a little bit of a shout out to Angela and her team for going
Yeah.
back through that report.
Yeah, Brent had a report built that caught a lot of chart of accounts and they went through it pretty quickly.
we're
And that
not
team,
done yet. but
yeah, that team has been really, it's the new people, you can just tell that they're passionate about what they're doing when you walk in there. They're happy, and I walked in, she's like, I just got a $12,000. And she like gave me a high five. So it's nice to see the teamwork back there for sure. You have some good people.
So I ran a report, I probably talked about it, that captured all the accounts through the hospital for the past fiscal year 22. And there was many accounts on there that had no payments, and I gave it to Angela and her team. They've been working very hard on it, and I ran it again this morning, and there was a difference of, I think, $440,000 that they were able to go back and bill for, and and actually received, they brought in $440,000 since that report, and that was a month and a half, something like that.
It's been 6 weeks ago you ran that for us.
Month and a half, yeah. So they were able to go back and get, track down that money, and that
Yep.
was a lot of work that they put in.
It's still ongoing, but we're getting.
Just looking at the report and the number of different things that they were addressing, like,
Yeah,
that's incredible.
they're busy back there, but it's just gonna be so much better to have it back in-house. It's- The outsourcing was not going well. I think that's all for me. No, not really.
Thank you very much.
All right, we still have provider recruitment in multiple different areas. I'm gonna touch on that probably a little bit more in the closed session, because there's some, personnel details, I got personnel details in there. So I'll kinda touch on that in the closed session. I guess besides oncology, I can say that, Dr. Smith has agreed to come an extra day per month, starting in January. That was official today, I think Krista finally got his day.
And they're not coming the first and third anymore, they're coming the second, third, and fourth.
Second, third, fourth. So we'll have 3 days of oncology per month now,
Great.
up from 2. So I think that's really good for the community, to have more access to that service. So, and then Megan already touched on nursing home. Yeah, I think that was about it. We covered pretty much everything. They're looking at until we do the feasibility study at least. We have a couple other things that we're looking at as far as that. I had a little bit about FEMA funds. I guess this year in March, we applied for a grant for COVID funds through FEMA, and it's a little over $1 million, and that got caught somewhere at the federal level, and some kind of miscommunication between the state level SEMA and the federal level FEMA. And Kevin has helped me out a lot with that. We went and tracked that down and got that process moving along. They tell me, the people at SEMA, the state level, tell me that they think in mid-December that funds should be coming our way, close to that $1 million. So I think that will really help out the hospital a lot. I'm keeping my fingers crossed, because I've kind of got the runaround from them a little bit, but I think that we got the ball moving again on that. So really hoping that those funds come through. I think that'd be a big help for the hospital. And then also I want to touch on Wyconna Medical Services, our clinic out there. I went to their city council meeting. So we kind of brought them a couple of options as far as what to do with the building. They're leaning more towards they want to gift the hospital the building. And so I've been working a lot with Kevin again on an agreement on what that might look like as far as down the road with repairs, because right now it would be much cheaper for them to gift us the building, because we would take on a lot of those repairs. So we're trying to come up with something that's a little more fair for the hospital, so that the city can continue to help us out with some of these repairs. They replaced the HVAC system, so we have heat down there, which is really awesome. We also had Sparks Construction come out. I think his name is Carl Miller. He came out and gave us, or he's currently putting together an estimate on what it would take to replace the roof, do some repairs to the outside of the building, and then there will be multiple repairs to the inside of the building that are needed as well, because the roof leaks, the ceiling has water damage. There's probably water damage within the insulation within the roof, or above the ceiling, and multiple other small repairs to make the building a little more nice for our patients down there. So we're looking at all that, and Carl will be putting us an estimate together to see what that will look like, and I will continue to talk with city council on their ideas, but just to give you all a heads up of kind of what they're looking at, so you can have it on your radar of what you all think that you might want it to look like. But that is a work in process.
So when we talked about this before, then include where it sits, the land, or
Yes.
just is the land where it sits?
There's not a whole lot of land there.
I know that, but before we didn't know that answer,
Yes.
so.
That's it for me.
Alrighty. Any questions? Alrighty. Then let's move on into old business. Hospital bylaws.
That would just be if you wanted to organize the committee to review and look at those.
It's kind of what the board wishes. Do you want to do that in committee? Did you want that, we talked about this a little bit last time. We really need to revise our bylaws. So, did you want to do that with a committee? Did you want that to be the whole board? How did you want to do that?
Committee's probably best, and then just bring it everybody.
All right. Do you want to suggest a committee for that?
Say 3 of you, and then you can sit on that.
What do you suggest for that?
I would be on that.
Cause I expressed concern about.
Yes, because there's several things in there that really need to be looked at.
Yeah, maybe the 2 of you and whichever working male would like to join. Jesse.
Jesse, would you be interested in that?
How was that?
The committee,
The
would
committee.
you like to be on the committee to revise the bylaws?
If I'd be willing to serve,
Yes.
Yes.
if I get asked, I can't say no.
Well, you're being asked.
You're being summoned.
Yeah, I will. Yes, I'd be willing to do that.
Alrighty. Alright, is that okay with everyone then? And then we'll go through, there's some redundancy in some of it, and there's some reverting in some of it, and then we'll just kind of,
Was there 3 or did I miss
Yeah,
one?
Jesse, Lori, and Chris.
I'm sorry?
Jesse, Lori, and Chris.
Okay, thank you.
and then we'll bring those changes to the whole board.
And you can tell us what we should have done.
Yes. You can say, no, I don't like this, and then we'll do that. Alrighty then. Going on to new business. Policies and procedures. Renewal and review. Any comment with that?
Just they need approved.
Justine said they needed to be approved each month and so they could document that for licensure.
And she just listed them out here,
Yeah.
so
Right.
we've gone through
So
the,
They used to be in consent agenda, but
Right.
yeah.
going forward, they need to have these specially approved.
Right. So you see that list there, the policy and procedure report. So you need to approve those, correct?
Yeah, so it would be October and November, and
Right.
we can give you access to our, policy website if you wanted to look through that at any time
Yeah, and they already have,
with your email.
I think Ken had contacted about giving you, I think you could get in with your username and your login
Yeah.
information already.
Yeah, but we can
On
get you that
SharePoint,
website.
Well, I'll move that we approve the approved policies and procedures.
All right, do I have a second?
So,
And a second from Aaron, Brenda? And let's have a roll call vote there. So Nick?
Yes.
And Aaron?
Yeah.
And Chris? And Jesse?
Yes.
All right. And then we have a notice of election. You wanna speak to that?
That will go in this week. So,
Should come out this week.
that starts at 8 AM on December sixth, so the 4 people will have to file on that date.
And that's for the April election. Alrighty. And then we have medical staff credentialing.
we just, we just go to the courthouse or wherever it is and
Yeah.
fill out that form.
Yep.
credentialing there. Most of that is pretty self-explanatory.
Dr. Schwartzman's over here? He's just on that. Dr. who? Schwartz.
He doesn't come anymore, but he's part of the blessing cardiology group,
Yeah, he's
so.
been the longest.
Yeah.
I'm wondering.
Aaron is obviously nurse practitioner.
Right. So we just need a motion to approve the staff credentialing.
I move that we approve the staff credentialing.
So I have that motion from Nick
I'll second.
and a second from Jesse.
I'll second.
All right, thank you, Jesse. So let's have a roll call vote, please, Nick
Yes.
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 and Jesse.
Yes.
Alrighty. Do we have any other business? And just a reminder of the Christmas party.
Next
is
Friday,
Next Friday evening, beginning at 5:30.
5:30.
Thank you.
At the VFW.
Okay, meal at
You can
six.
get a head count from the board. Oh, I already know Lisa wanted to.
Okay, thank you.
And they needed a specific count, or any of the board members I've turned in, Christine
And I did tell him.
and Jesse. And you. Or either one of you agreeing, and I don't know about Travis, so I hadn't heard from them, so I was thinking not. Thank you. Okay. And you're bringing,
Oh.
Travis.
you're bringing a guest?
Yeah,
Invite
I
Joe.
think I'll let him go.
He's been pretty good this year.
He's been pretty good. He's put up with me. I'll let him go. So, alrighty. As there is no other business, I would entertain.
Can I ask one
Yes.
question? It's wasn't
Yeah.
on the agenda, but it has to do with dates. The December meeting is scheduled for the
Oh, yeah, we
27th.
should talk about that.
Is that gonna be a conflict for anybody? If not, or if it is?
Okay, that would be on the what now?
Tuesday the 27th.
Tuesday the 27th. So you talk about that, thank you, Brenda. Tuesday, December 27th.
I'm good.
I'm good. Jesse, are you okay with?
Sorry,
with
sorry,
that?
I was having a hard time understanding.
This
What was
December,
that question?
December 27th for the next board meeting, does that work for you, the 27th?
Yeah, that should work, as far as,
Okay.
yeah.
We'll just keep it regular day and time then.
Alrighty. Tuesday, December 27th. Alright. If there's anything else? Alright, then I would entertain a motion to go into, closed session pursuant to Missouri Sunshine Law, 610.021, sections, 1 legal, 3 hiring, firing, and discipline of employees, and 13 individual identifiable personnel information.
I so moved.
Second.
Alright, so, what's your roll call vote there? Nick,
Yes.
Aaron,
Yes.
and Justin?
Yes.
Alright, we thank everyone for coming this evening.